So hi Andy.
How are you?
Good to have you here.
Thank
on
you.
the interview.
Yeah.
How are you?
Doing great today.
We're in Amsterdam right now. You're giving a course on ophthalmology.
Mm-hmm.
And well, it would be nice to have just some questions, because you were explaining yesterday already how it started. I mean, you started training acupuncture 25 years ago,
Mm-hmm.
and then you just found out that there wasn't any on the eyes, limited.
Yeah.
So can you elaborate a little bit on your quest?
Yeah. So when I graduated acupuncture school in '96, when I was in school, one of the things that they told us was that acupuncture is not too good for treating eye disease. There wasn't information. I had maybe 3 sides of notes for all eye conditions, all eye diseases, and there wasn't much education on it. So my belief system when I graduated acupuncture school was, well, if I could help people with headaches, and I could help people with menstrual cramps, and I could help people with shoulder pain and allergies, why can't I help them with vision conditions? So it was questions around that frame that we can't help people with these eye conditions. So I found that there wasn't a lot of information available, so I started on a quest to find information on Chinese medical ophthalmology or any acupuncture systems that people were using that showed some promise to treat these eye conditions. So the more I started to research, the more interested I got, and the more I started to attract more patients who had these eye conditions, which gave me a great experience to try these systems to see if they actually worked. We found some worked, some didn't. The ones that worked I continued to use and maybe add different treatment strategies to, and the ones that I didn't find to work doesn't mean they didn't work as acupuncture systems or acupuncture points. They just maybe weren't so good for treating eye conditions. So we went through a lot of systems to see what worked, what didn't work, and over the years we just refined it. We learned systems like microacupuncture and a lot of other systems like auricular, some Chinese medical, acupuncture, traditional Chinese medicine, electroacupuncture, found to be very, very beneficial, especially when we combine a lot of these methods together. Sometimes one system will produce a good result, another one system maybe produce a good result, but together they produce a really, really good result. So a lot of the clinical research has been around finding which systems will get us the best results for patients.
And this is just all by trial and error, because there wasn't enough data, or like the books from the old days, or the teachings in school.
Yeah, so, that's right. It was a lot of trial and error, because people would tell me that this is a great system, works great for eyes, or we could definitely help eyes.
And then you put it to the test?
Yeah, I had to put it to the test, because I didn't want to just believe somebody. You want to test it, and sometimes it worked and they were right, and sometimes it wasn't. So the ones that worked we continued to use. The ones that didn't.
So that's real pioneering.
Yeah.
And that's I mean, we owe you a big thank you, because nobody's done it. I mean, a lot of colleagues or a lot of people in the old days just left the eyes. They treated all the other stuff, but the eyes were just a little bit neglected, and you weren't buying it, right?
That's right.
And that's a good way to start a quest.
Yeah. Just question. And well, I don't know. And I wanted to help people. I had some patients that I really cared about, and they actually pushed me. The patient, you can help me. I think you can help me. So I'm a new practitioner. All right, let's see what we can do. We can find. So I was committed to helping them, and inside of that commitment and questioning the premise that acupuncture couldn't help eyes. Plus, back then I had a little bit more time. I wasn't married, didn't have kids. My practice was a little bit slower, so I had the ability to do a lot more research
and to ask questions, to get a holistic view of why certain things happen in the human body. Yeah,
accurate. Yeah.
So you did, and the eye conditions that you treat now on a regular basis with acupuncture. Well, we talked about glaucoma.
Yeah.
Diabetic retinopathy, and some more. Maybe you can
so in ophthalmology there's a lot of different eye diseases we can treat. My focus is on neurodegenerative eye diseases and traumatic eye diseases, like eye stroke would be traumatic, maybe retinal bleed or retinal detachment, something like that would be more traumatic. Sometimes eye injuries, but more neurodegenerative conditions like glaucoma, macular degeneration, retinitis pigmentosa, diabetic retinopathy, you see a lot of dry eye, cataracts. So these conditions, a lot of which there's poor or no conventional biomedical treatment for, we found that we get actually very good results with acupuncture in terms of recovering some vision, and then long term we want to help them preserve vision or keep what they have.
Yeah, that's great. So you get a lot of happy customers, because usually they get from their general, like the allopathic medicine, they get like nothing. Like,
correct.
You will go blind eventually.
No hope.
No.
It's very doom and gloom.
Yeah.
You're going to go blind, and sometimes you'll go blind in a year or 2 years.
Oh, right.
They don't know. It's scary. It's very scary for people to have no hope. So part of it is convincing people to not believe necessarily that their doctors tell them there's no treatment, but what that means is there's no drug and no surgery inside of biomedicine, and biomedicine is a system of medicine, but it's not the system of medicine. So there's a lot more that could potentially be available that we're finding.
Yeah, and it's good that you have a cooperation, because for the eye pressure you recommend to go to an ophthalmologist, because they do a great job in that.
It's integrative. So we promote not just Chinese medicine or Western medicine is bad, it's integrative. So use both together creates the best outcome for patients.
Yeah, and the satisfied experience of your customers is not wishful thinking, because you do also a lot of testing just to make sure you got your data. And some of the tests are quite easy for colleagues like me and people who are watching this to do. You talked about the Amsterdam grid and the vision field, some
eye
other
charts,
testing.
color vision. There's fancy vision testing that you can certainly do, but to do a baseline eye test, there's Amsterdam grid, there's color vision, there's contrast, there's the eye charts near and far. And again, it depends on your state and your country on what you're allowed to do, but certainly you can see some functional improvement, and we want to have a metric. Of course, it's great when patients tell us that they see improvement with their vision, but we want to marry that up to a metric that allows us to quantify they were here and now they're here.
Yeah.
So we have subjective and objective improvement, which really can be documented and shows a real positive, strong outcome.
And quite easily without buying any fancy, very expensive equipment. That's very great. So you mentioned already some different methods. If you can watch your shirt, it's like the microacupuncture, the microacupuncture 48. Yeah, that's your thing. Yeah. So there's a story behind that, right?
Yeah. So the microacupuncture 48 is a hybrid. It's a newer system that we use. It's a hybrid acupuncture system that combines an older system called Equiwo, which is developed by Professor Zhang years ago, with meridian acupuncture and reflexology. The Korean systems and the micro systems around the reflexology points. So we've combined those together, and we found that for certain conditions, specifically eye conditions and central nervous system issues like brain, we have a tremendous efficacy in terms of a real result that we can produce using these systems. Now, the cool thing about microacupuncture is it can be used alone as its own unique system, or it can be used in conjunctive with other systems like traditional Chinese acupuncture, tongue, tan, Japanese style, 5-element, whatever style you use, you can add this system to that and just get better results. So you don't have to discard everything and it's not superior, the system is better than any other systems. No, like every other system, microacupuncture has some conditions that it's very, very effective for, like treating eyes, and then some maybe not as good. Maybe some of the other systems will get better results with other conditions.
Yeah, and like every practitioner is using their own system. Some use laser more, some give a lot of eye exercises with them, or a regular eye acupuncture. And it's always the case for the practitioner to make a good diagnosis.
100%.
There are no fixed.
There's no quick fixes.
No.
Everybody wants the quick fixes, and these work. These will get improvement in your vision just using the points. But as we know in Chinese medicine, functional medicine, naturopathic medicine, you have a body attached to the eyes, so we can't be lazy and disregard the underlying causes or the pattern differentiations or the TCM constitutional diagnosis. We can't neglect that and ignore that. if we want to have lasting results and long-term stabilization, which is really, we want to try to improve the situation with their eyes and then create long-term stabilization to help them keep what they have.
Yeah, so 1 illness, 10 treatments, because
100%.
That's how we trained. Well, do you have anything else to add or to motivate people to start treating eye diseases? Because I think you're quite alone in this position.
Yeah.
There are more people doing this, but you're quite specialized in it.
Yeah.
And I think there are a lot of people in need, a lot of patients that, as we discussed already, they just walk into a dead end.
Yeah.
So we need more colleagues to be active in this.
We definitely need more people trained. I have patients email me every week from around the world who are seeking practitioners. We've leveled up our marketing strategies significantly over the last year or two, and the effect of that is there's more awareness, but people are also all over the world, and there's global awareness increasing about microacupuncture and Chinese medical ophthalmology and ophthalmic acupuncture. And the demand is increasing because of the awareness that's increasing. So we're having, we need more practitioners to do this. So acupuncturists who are interested, we have online training, we have books, we have live trainings. We're in this gorgeous city in Europe, Amsterdam right now. I like to do more live trainings. We're going to be doing a lot more of those. So everybody can start at their own pace. You know, you want to just get an introduction to it, buy one of the books, we can do that. You want to take one of the live seminars, you can do that, one of the online seminars. You want to watch some of our YouTube videos or go to our microacupuncture Facebook group and get information, just kind of lurk and kind of see what's doing in that. But we have all levels of education. Some people are, they want to learn it all and be specialized. We have that level. Other people just want to see what it's about. We have that level of training too. But yeah, to your point, we definitely need more people.
Yeah, and any start is a good start, because people don't have an alternative. So, and we all have to start at some level, and then we grow from that. Yeah,
that's true.
Okay, thank you very much. This is really really exciting stuff.
You're welcome.
And
thanks.
You're doing great.
Thank you.
Thanks. Cheers.
Appreciate it.
Just getting this shot.